Dutch healthcare system might seem complicated, especially if you're coming from countries where you're used to a more straightforward approach. Do I have to pay for a healthcare insurance? How do I choose a healthcare provider? What the heck is Eigen risico? Let's once and for all figure it out so you will gain clarity and won't spend your money on things you don't understand. The Dutch healthcare system is based on a universal healthcare insurance model, which means that everybody in the Netherlands is obliged by law to have health insurance. It's called basisverzekering, which means basic insurance. Every year the government decides what will be included in this basisverzekering, so all insurers in the Netherlands are obliged to follow and provide you with the same package. This means that the package itself will not be different across different insurers, but the price might vary. The reason why insurance in the Netherlands is obligatory, the way I understand it, is that the government protects itself this way. So if an emergency happens, they don't have to pay for you because you've been paying for your insurance for a while now, but it also protects you so you don't have to incur significant costs at once, like it happens in the US. If you have a low income, you might be eligible for zorgtoeslag, which is a healthcare allowance provided by the government to help offset the cost of your health insurance premiums. It's worth looking into if you meet the income requirements. So, as I said, basisverzekering is what you're obliged to pay. If you need anything extra like glasses, alternative care or physiotherapy, you need to get aanvullende verzekering, which means additional insurance. The way it works money-wise is that, let's say you pay 100 euros for basisverzekering, and on top of it you pay 5, 10, 20, 40 euros for aanvullende verzekering, depends on the package. You don't have to take it if you don't need it though. Tandartsverzekering, which means dental care insurance, goes separately and you need to pay for it if you're older than 18. You can choose different packages as well. It can be unlimited dental care, which can cost 40 or 50 euros per month, or you can choose that 100% of your dental expenses will be covered, only 50, only 75, depends on your needs. You are also not obliged to take it if you don't need it. So the equation for now looks like this. Monthly premium equals basisverzekering plus aanvullende verzekering plus tandartsverzekering. And we know that out of these three components, you're only obliged to take basisverzekering. Now, since we got this out of the way, let's add one more thing in here. It's called Eigen risico, which means own risk. I'll first explain what it means and then we'll give you some examples, so don't worry, it will be crystal clear, we'll figure it out. The Netherlands gives you a choice of how much of your cost you're willing to cover per year before your health insurance coverage kicks in. This is called Eigen risico. It can be a minimum of 385 euros and a maximum of 885 euros. This applies only to basisverzekering, because for aanvullende verzekeringen, the terms are already stated. You know what you are getting. For example, 10 physiotherapy sessions per year, or for alternative care, you get coverage up to 200 euros per year. For dental care, it's the same story. The terms are already stated. So this Eigen risico thing applies only to basisverzekering. And as I said, Eigen risico is a total deductible amount that you have to pay out of your own pocket before your health insurance coverage kicks in for certain medical expenses. It's probably still confusing, so let me give you an example. Let's say I need to do some blood work, which costs 100 euros, and then an MRI scan, which is 200 euros, and then X-ray, which is 100 euros. So in total, the cost of these is 400 euros. If my Eigen risico is 385 euros, I will have to pay 385 euros out of my own pocket, and this 15 euros will be compensated back to me. So anything I spend above 385 will be compensated back to me. If my Eigen risico is 885 euros, I will not get compensated for anything until I reach and exceed this amount, 885. Here it's good to know what's included in your basisverzekering and how much it costs. For example, visiting GP, general practitioner, huisarts, is free of charge in the Netherlands. But if your GP refers you to do an MRI scan, sorry, I keep giving this example because this is what happened to me. My physiotherapist told me that MRI scan is included in my basisverzekering and it should be free of charge for me, and I haven't checked it, so it's my own fault. But then I did it, and 2 months later I got a bill for more than 200 euros. So always ask your GP how much things cost. Call the hospital, because in the Netherlands it's strictly regulated. They have a spreadsheet with all the prices, so they will be able to guide you. The rule of thumb in the Netherlands is don't do anything until you know how much it costs and how it works with your insurance. Now, how does this Eigen risico affect how much per month I pay for my insurance? As you remember, monthly premium is basisverzekering, aanvullende verzekering, and standaardverzekering. So Eigen risico affects how much you pay for your basisverzekering per month. The higher your eigen risico is, the lower you pay per month for your basisverzekering, which makes sense, right? Because if my eigen risico is low, for example 385, it means that my insurer will have to start offsetting my healthcare costs sooner. It's a bigger risk for them, so they have to charge me a higher premium per month for my basisverzekering. It's good to mention that your insurance starts per 1st of January, so you cannot change your insurance plan and insurance provider in the middle of the year. This is why the Dutch are so into planning. Because think about it, why would I pay so much for my basisverzekering? Meaning, why would I set my basisverzekering at 385, for example, if I don't plan to undergo any medical investigation this year? The rule of thumb is always think ahead what you want to do with your health next year. Is anything bothering me right now that falls under basisverzekering? If the answer is no, then I'm going to set my eigen risico as high as possible for example, 885, because chances are I'm not going to need it. I'm not going to go in under any medical investigation next year, which allows me to pay a lower monthly premium for my basisverzekering. Then I think of any additional help I might need that falls under aanvullende verzekering. Do I need any physiotherapy sessions this year, for example? And then I pick my plan accordingly. I also say all these terms, aanvullende verzekering, basisverzekering, and standaardverzekering in Dutch, because it's good to know these terms in Dutch so you can orient yourself better when choosing your healthcare insurance plan. Then in November, not in December, because in December everyone starts thinking about their insurance for the next year and it's very busy. So in November, go see a dentist and ask their opinion for what needs to be done. Ask them to estimate the cost so you can plan your insurance for the next year accordingly. And please know that sometimes it can be a little bit confusing. For example, if you need to pull a tooth at the hospital, then it doesn't fall under dental care insurance anymore, but it falls under basisverzekering, and then you need to navigate your eigen risico, not your dental care insurance. But if you're getting your tooth pulled at the dental clinic, then it falls under dental insurance. I know it sounds very complicated, but you can ask your dental clinic and they should be able to guide you. Now, how do you actually find all this basisverzekering, aanvullende verzekering, and then standaardverzekeringen? There is a website called Independer.nl. You can put your requirements in there and they will give you price comparisons and options that you can choose from. On top of it, if you book your insurance with them, you get €10 off on bol.com. This is not sponsored, of course, it's just a genuine advice. A few words about how the system works. So your first point of contact for non-emergency medical issues is huisarts, or general practitioner in English. They manage your overall health and can refer you to specialists if needed. The good thing in the Netherlands is that you can choose your own huisarts, sometimes in your own language. Sometimes it can be hard to get a referral from your GP because in the Netherlands it's not a preventive medical system, which means that I cannot simply go and see specialist and do a health checkup. I need to have a solid reason for it, and then I go to see my GP, and if they think that my reason or my complaint is valid, only then they will refer me to a specialist. Good to know that in case of emergencies in the Netherlands, you need to call 112. You can go to any hospital's emergency department for any urgent issues, regardless of your insurance provider. This is all you need to know about the healthcare system in the Netherlands. If you have any questions, please feel free to hit me up on Instagram. I'm usually fairly responsive. If this video was helpful, then like it and subscribe to my channel, because this helps a lot with the YouTube algorithm and help me know that what I'm doing resonates with you. Thanks for watching, and until next time.